Hello, bonjour Alberta. Did you know that at least 238,000 people speak Français in Alberta? And those numbers just keep on growing? Oui, oui, c'est vrai, it's true. And thanks to Shaw TV Community Access Programming, we get to reach out to everyone to let you know all about special people, places, events, and activities happening right here in this great province, in both English and en français. That's right, mes amis. We begin the first part of our program in English, and then we repeat it en français. So stay with us. Restez à l'écoute.
Welcome et bienvenue to Hello, Bonjour Alberta. I'm Marc Lalonde. In this episode, we're very pleased to welcome Alison Nowoselski, who is an optometrist based here in Calgary. And we're going to learn a lot of very interesting things about optometry. Welcome.
Thank you. Thanks for having me.
Let's start by finding out more about yourself. You weren't born in Calgary, were you?
No.
No, almost nobody is.
No.
So where are you from?
I am from Prince Albert, Saskatchewan.
Okay, so
Yeah.
you grew up in Prince Albert.
Yeah.
And where did you go to school to become an optometrist?
I did my undergraduate degree in Saskatoon, so I did a Bachelor of Science there, and then I went to the University of Waterloo in Ontario for my optometry degree. So 7 years of schooling.
So how did you make your decision to get into optometry? How did that come about?
I always knew I wanted to do something in the health field, and working, I wear glasses, and I wear contacts, so being in that environment, I knew that was something I was passionate about, and then ever since then, I just followed, even since high school, I knew I wanted to go into optometry. So,
Really?
Yeah. So.
Okay, so you were
Right.
quite the keener as
Quite
a
the keener,
student,
yeah.
I think.
Yeah.
All right, all right. And then, but now you're here in Calgary.
Yeah.
So how did that come about?
My brother is here, so I have 4 older brothers, and 2 of them are in Alberta here, so one of them lives here, and he has 2 little kids, so I wanted to be closer to them. So we do a year of rotations or placements after we finish schooling, and so I worked at some clinics here, and I fell in love with the city and the mountains. So I've been here for almost 2 years.
So another person who caught the bug.
Got the bug.
Yeah, I guess.
Yeah.
Yeah, so is Calgary what you imagined it was when you were living in Prince Albert? Yes, it was? Yeah?
Yeah, it's a little bit different than Prince Albert.
Yeah, a little bit. A
Yeah.
little bit. I've spent time there myself.
Yeah.
All right. Well, let's get into one of my favorite subjects,
Yeah.
optometry.
Yeah.
So, what is optometry? Can you give us a definition and maybe differentiate it from the other areas that are involved in eye health?
Absolutely, yeah. So optometrists are just like your general family physician, but for the eyes. So we're the mediators. We check everything from the eye health to the alignment of the eyes to the prescription. So we do everything. If we need to refer you for surgery, we're the ones to do that. We communicate with the surgeons. So an ophthalmologist is an eye surgeon. So they take different schooling than we do. And then an optician, another O word, an optician is somebody that specializes in just glasses, so they don't look at the health of the eyes. So lots of differences, but an optometrist, yeah, basic everything in terms of eye health needs, and then we direct you from there. Yeah.
So just to be clear, an optometrist is a real doctor.
It's a real doctor. We get asked that a lot, yeah. Yeah.
No doubt, yeah.
Yeah.
So you have training not only just in the eyes, but how that
Absolutely.
integrates with all the other systems.
Absolutely, yeah.
You can prescribe drugs.
Yep.
And all kinds of other treatments.
Yeah, absolutely. The eyes are a part of the body, so we can see so many different systemic and different diseases in the eyes. So often we're the first people to diagnose things like diabetes, things like high blood pressure, high cholesterol. We can see them in the eyes. So it's really interesting.
So is there some truth then to this irisology thing where you can stare into some people's eyes and say, you've got this problem?
Not from the iris, no.
No.
I don't know if I believe that.
All of that other
Yeah.
stuff. All right,
Yeah.
so an optometrist is basically a doctor,
Of
a
the
medical
eyes.
doctor who specializes in the eyes.
That's exactly it, yeah.
Okay, so when clients come in, what do you look for? And does that vary according to their age or their gender or other factors?
Absolutely. When they're young, obviously we can't do as much and get as much of a response from them as we can with somebody that's older. But even at 6 months of age is when we say to have the first eye exam. And they're covered through Alberta Health for eye exams up until the age of 18. So every year from the age of 6 months to 18 years, we say every year to have their eyes examined. As they're growing, their eyes are growing. So we take a look for those big changes in prescription, big changes to make sure that the health is, everything's okay. And then from then on, we kind of base it patient by patient basis as to what we're looking for. If they do have diabetes, we do want to see them every year to make sure there isn't, signs of the diabetes in their eyes that can affect their vision. And then over the age of 65, we recommend every year, and Alberta Health here in Alberta covers eye exams over the age of 65 every year. So that's really, really helpful. And then with age, obviously, there's more eye disease there. So we want to catch it before it actually affects the vision, and something that we can do to stop it.
So it's always very important to catch things earlier.
Before, yeah, absolutely.
As early as possible.
Yeah.
All that sort of thing.
Mm-hmm.
Okay, so you mentioned diabetes.
Yeah.
That affects the eye health quite a bit. Are there other conditions that are linked to eye health?
Absolutely, yeah. Multiple sclerosis, there's different types of arthritis that can affect the eyes. I said diabetes, high blood pressure, high cholesterol, and then there's eye diseases. So there's glaucoma, macular degeneration, all these types of terms you've heard in the past, but unsure what they are. And lots of them, you don't notice the signs of vision loss or damage to your vision until we detect it, and it's too late to treat it. So it's something you do want to catch early. Yeah.
All sorts of things. So if a person follows proper health of the eye, how long can you expect to see well?
Oh, that's a difficult question.
I'm sure it varies from one person to
It
another.
does, yeah, very much. It depends on the prescription. It depends on, again, the health of their body, the health of their eyes. So that's a hard question.
Is it like everything else, where if you take care of your health generally, that will also contribute to your eye health?
There are genetics that play a factor. So just like anything, you can have glaucoma that's due to genetics and lose vision that way, even living very healthy. So again, that's something that we treat early. But yes, living healthy really helps with the eye health as well.
Okay, let's face it. Most people go see an ophthalmologist just so they can check out all the neat gear you have.
You mean optometrist?
Optometrist, pardon me. Optometrist, yes, because of all the neat devices that you have. And, you're looking at little farmyards in the distance and little dots and things like that. Can you tell us a bit about what's current equipment and the clinic that you work at? Is that something that is emphasized in the profession?
Absolutely. So I work at a clinic. The group of clinics that we work at, it's under the umbrella of a bigger company, and that's called FYI Doctors, and they really focus on having the best technology and investing in that technology. So we have an Optomap camera, and what that means is we have a camera that takes a picture of the back of the eye, and so then we have photo documentation of your eyes, which really helps in just caring for you, even caring for everybody's eyes a lot more accurately. So we have that. We just invested in some new machines. They're called an OCT.
OCT?
An OCT, and it stands for optical coherence tomographer. So
of course.
It's a mouthful.
How could I not have guessed?
You knew that. And what that does is it scans through the layers of the back of the eye, and it really helps in the diagnosis of things like glaucoma and macular degeneration and different swellings of the back of the eye. So really, really helpful. So we're always trying to build up new technologies in our clinic so that we don't have to refer as much. So we have all the primary care within our clinic.
So do some of these technologies replace older technologies like x-rays, for example?
They're all kind of in addition to, and they all are getting better and better, more accurate and that kind of thing. So we still have old testing, different side vision testing and things that have been around for years, and they're still working well, but the newer models of them, so more accurate, like I said. But then there's also newer instruments too that are always coming out, and we're always trying to invest in those, so yeah.
Well, you're obviously quite interested in that sort of thing too, and better than anyone else, you would know what's coming down the pipe.
Yeah.
I read all kinds of interesting information about new technologies for eye health, for improving vision.
Yeah.
Is that something that you see coming down the road, and can you tell us maybe about some of the things that are in development?
Absolutely, yeah. They're always coming out with new, different technologies. You know, LASIK was really popular for many years, LASIK surgery. There's many different types of refractive surgery coming, so different types of refractive lens exchange procedures. So that's different types of putting the prescription in the eye instead of doing it on the surface of the eye, on the cornea. So lots of different types, eliminating the need for reading glasses, distance glasses altogether. So there's many different types. Again, we're referring for that, so we don't do that ourselves, but we can educate the patient on a patient-by-patient basis as to if they're a candidate for that.
So I'll ask you a personal question. Do you think there will be, within my lifetime, a technology that will permit older people to focus far and near again, instead of being kind of stuck in that mid-range and having to wear glasses for everything else?
Absolutely, yeah, there will be. And there are already some coming out, so just wait and see.
So it's coming out.
Yeah.
So it'll only cost, you know, $3,000 or $4,000 an eye at first, and then eventually it'll be down to $300 or $400 an eye. Is that right?
Hard to say, but yeah, they're always
like
coming
that?
down in cost. Yeah.
Okay. Let's get to what advice you would give to people. Now, obviously, we talked about annual examinations for people under the age of 18 or 18 and under and 65 and over.
Yeah.
But what other things can people do to take proper care of their eyes in concrete terms?
Absolutely. Just kind of going back to the 18 and younger, in kindergarten, kids are given, we have a program with the Alberta Association of Optometrists, and they have a program that they give free eyeglasses to kids in kindergarten. So just to make awareness of starting that early. So school is so affected by if our eyes aren't corrected and our vision's not working. So just to kind of mention that, so that the Alberta Association really does a great job at promoting eye health for young kids. But taking a look at regular exam, or doing regular exams, so every 2 years between the ages of 18 and 65. Again, that's a very general statement. There might be factors we want to watch you for more regularly, so always seeing your optometrist to check when you should be seen. Like I said, it is,
that's right,
everybody's
optometrist
different,
will say
and
that.
so
Yeah.
not just saying a generalized, but like I said, there's so many things that you can't see that are going on in the eye, and if we can prevent those sooner, then that's always, if you are having any troubles, to come see us right away for any medical need. We can see you. So Alberta Health covers lots of eye exams as well. So,
what about eye stress?
Yeah.
You know, people who spend all day, like me, looking at a computer screen, or doing something else that is kind of stressful. Is that really not a problem? Are our eyes that strong that they can take that sort of thing? Or is there something we should be doing to reduce the effects?
Our eyes are very strong. We call it the 20-20 rule. We always say after every 20 minutes to look somewhere for 20 seconds, 20 feet away, to give the eyes a break from focusing up close. There's also something called computer glasses, if you haven't heard of those before, and those are designed for just that intermediate distance, so not for up close, not for far away, but for that computer, because we're so technology driven in this day. So yeah, there's lots of different glasses for every task. Yeah.
I'd hate to not be able to focus at that distance. That would be. I'm aware of some software that you can actually put on your PC that'll remind you to, get up and move around. I guess you could program it to also say, look into the distance.
Absolutely,
I guess.
yeah.
Okay, if somebody wants to learn more about optometry, should they see an ophthalmologist? Is there information on the internet at any place that
there is information on the internet about eyes, just like anything on the internet, but I would always visit your optometrist if you had any concerns about your eye or eye health. And that would be the best thing to do. Yeah.
Well, thank you to our guest, Alison Nowoselski, optometrist. Please stay with us. We return en français.